Are you frustrated that no matter what you do, how much care you get, and how much money you spend, you continue to struggle with your health? For 32 years, I've been helping frustrated people turn their health around, and I've discovered that there are two easy to fix reasons why you struggle. So in this video, I'm going to help you fix them. By knowing exactly which doctor or healer to see when, I'm going to give you an easy and powerful tool that shows you exactly where you need to focus to get well. So let's start by looking at an email from Colleen. And she wrote me that she was told to see me, but she's nervous. That I have a lot of GI distress and I've had my gallbladder removed. And I've had a CT, 2 MRIs, several ultrasounds, and lots of blood work. Everything looks very good, they keep telling me. I've changed my diet and eliminated wheat and dairy, and lately I've been seeing my acupuncturist and massage therapist, and nothing is working. I am running out of money, and I'm frustrated that nothing is working, and I need help. I see this all the flippin' time, and it's a massive problem because you want to get well. You know, you go see your doctors, you get care, you spend your time, you spend a lot of money, and your health doesn't improve. So why is it that we struggle with our health? You know, your digestion is off, but why? Your energy is low. Why? You have hip or shoulder pain. Why is it? Well, here's how I see it. Let's take my water bottle. If I asked you to guess what's inside here, could you with certainty tell me what's in it? I mean, sure, you could say water, but are you sure that there's water in here? Well, no, because you can't see inside it to know what's in here. Well, that's what it's like when you're trying to fix a health issue. Just like you can't see into this bottle, you can't see inside your body, so you don't know why you feel like you do. And Colleen did what we all usually do, which is we go see our medical doctor, and for them to see inside of us, they run a bunch of tests like blood work, MRIs, CTs, and ultrasound, and so on. Now, if your health issue is due to a medical problem, then bingo, you got lucky right away. You went to the right doctor who can tell you what's wrong and what to do to get better. But here's what I see happen a lot. You go to your MD and your health problem is not a medical issue. So just like Colleen, you have lab work run and they tell you, well, that looks great. So no answers there. I mean, how frustrating is that? Well, because the labs didn't give any answers, then they dive deeper and they order a CT scan and that comes back clean. Then they order not 1, but 2 MRIs and both of those come back clean. So they do an ultrasound and you know what, just stop. Your doctor already looked inside of you and to them, you were empty. They couldn't find why you felt bad. When this happens, this is a clear sign that you are seeing the wrong person to help you heal. Now, at this point, I see people do one of two things. First, they stop trying to fix their health and they just live with the issue they have. And this one absolutely blows my mind because I've had people who, with the proper guidance, can turn their health around and they tell me, I don't need any help. Nothing can help me. Or like Colleen, if you are aware of other doctors and healers, then you try them. So you go try a chiropractor or an acupuncturist, maybe a naturopath or a dietitian, maybe an energy healer. That supplement sounds really good, so I'm going to try that one. Or maybe I'll try that one. You keep going looking for answers, which is fantastic, but there's a problem here. You are guessing at what care you need. That's like guessing at which street to take home. Maybe you get it right, but mostly you take the wrong street and you get lost. Well, that's exactly where Colleen found herself. Guessing, trying different types of care, and all she got was frustrated while wasting her time and spending a lot of money that she didn't have. So let me show you the tool we used for Colleen and that you're going to use too. So you can see inside yourself to figure out where you need to focus your healing efforts. And this tool works by tapping into a special part of your brain. Now, there are several parts of your brain, and the part we know the most about is the part we use constantly. We read books, we listen to music, have conversations with it. It's the part that thinks and solves problems and is watching this video right now. That part of your brain is great at thinking and problem solving, but honestly, it sucks at knowing what's going on with your health. So we need to tap into the part of your brain that knows all about what's wrong with your health and how to fix it. And it's like a different streaming service. You know, when I want to watch one show, I go to Netflix, and I want to watch another, I go to Apple TV. And then when I want to learn something cool, I come to YouTube. Well, when you want to see inside of you, then you connect to a different part of your brain, a different channel, so to speak, and see what's going on. Now, let me show you how this works and join with me in doing exactly what I do. And if you can't do this right now, then come back and do this when you can. So let's stand up and I'll show you the lean test. As you stand, you're going to let your body relax. And what is going to happen is you're going to ask your body a question. And as an answer, your body is going to lean forward for yes or backward for no. So to make sure you're getting the right answers, you want to start by asking yourself a simple, true question. Like, is my name Steve? And then watch what your body does. I lean forward. So do this for yourself right now. Ask your body, is my name? And then say your name. Good. Did you feel your body fall or lean forward? Well, that forward lean is a yes or a true answer. Now, I'm going to ask myself a false question. So if I say, is my name Susan? What does my body do? I lean back, which is a no. So I know right there that I'm getting the right answers. Leaning forward is yes. Leaning back is no. Now, this is the point that some people run into problems, because if you had nothing happen or you felt yourself wobble a little, which is common, what most people do when they're first learning this test is that they hold themselves very stiff, because we don't want to fall over. So you hold yourself still. Well, if this happened to you where you're not sure what your body did, then relax, shake off any tension and try it again. And this time, allow your body to lean forward or back without stopping it. And if right now your mind is saying, no way, this is crazy, I totally get it, acknowledge that and remember that you want to improve your health and that I'm showing you how to use a different part of your brain that you might have never used before. So of course this is going to be weird. Do the test several times, get comfortable with it, and allow it to happen. All right, you got the lean test down now. So let's have some fun and let's look inside your body. And to do that, you need to know first what you're looking for. So health issues in healing falls into 4 categories. The first is medical. You have a medical condition going on, and this is a diagnosis of a disease and you're using medication as treatment. And then our second is physical. Now, this is that your health issue is from a physical problem like a muscle imbalance, a spinal misalignment, or that you were hurt in an accident or from sports. And the third is nutritional. Now, this is toxicity and deficiency. So toxicity is that you need to cleanse your body of something. And deficiency is that you're lacking in nutrients like magnesium or B vitamins, any of the myriad of nutrients we need to help our body. And then the fourth is emotional. And emotional means you are carrying negative emotions from your past. So these are the painful memories and feelings that stick with you, like getting divorced or fired or the tough times in life, all right? So now let's use that information to take a look inside of you. And what I want you to do is think about the tough health issue that you have right now. And it can be anything from digestion to depression. And I want you to think about it and feel it in your body. Okay, now that you've got that and you're connected to it, ask yourself this. To heal this, do I need medical care? Do you lean forward for yes or back for no? Then ask, to heal this, do I need physical care? Again, forward is yes and back is no. And I think you're getting the idea. So now ask yourself, to heal this, do I need nutritional care? Forward is yes, back is no. And to heal this, do I need emotional care? Again, forward is yes, back is no. So now, with those 4 simple questions, you got your answers and you know where you can focus your efforts to get well on the categories where you got the yes answers. Which category do you think is the most common one that I see when people are struggling with a health issue? You know, I've been in practice 32 years, so I've seen a lot of people, and 75% of the time when someone is struggling with a health issue, it is because of emotional baggage. When we did this test with Colleen, we found emotional baggage anchored into her digestive system. And because emotional baggage does not show up on medical tests, that's why her lab work, her CT, her 2 MRIs, her ultrasounds, they all came back with no findings and the doctors were stumped. And the emotional baggage is why the diet changes didn't work, acupuncture didn't work, and massage didn't work. Colleen needed to shift her focus to releasing her emotional baggage that was locked in her digestion. So we started releasing Colleen's emotional baggage, and her digestion began to improve in just 3 days. She had less pain, less bloating, and she's pooping better. Now, we still have layers of emotional baggage to clear for her, but she's feeling better, or much better than when we started 2 months ago, and she's continually improving. Now, since most of us have emotional baggage, what you want to do is you want to go watch this video next, and I'll take you through a guided healing session to help release your baggage.